to tell you a bit more about the MD research program, how you can get involved if you'd like to propose a project and supervise some medical students. We have been involved in the joint medical program for many years now with this, and this is the medical program that is run across the University of Newcastle and the University of New England, if you're not sure what that JMP, Joint Medical Program, means. As of this year, I'm the chair of the MD Research Committee, and I've been the course coordinator for the Year 4 research subject since 2020 when it was first run. And Adam was very involved in the initial decisions around how research was going to be part of the curriculum and so on, I guess would be the way to describe it. And he is the course coordinator for the Year 3 research subject and has been since the beginning of this program. So yeah, 2019 was the first Year 3 cohort for the MD. It was previously a Bachelor of
MBBS.
Yeah.
So just a Bachelor of Medicine and Surgery.
And so now it's been an MD for a few years now. So how is research taught across the JMP? So in Year 1 and 2, the students get some foundational skills around health measurement for research, study design, research as a way of investigating clinical questions, and critical appraisal of research publications. So this is an undergraduate entry program, so many of the students have come straight from high school, although there are others that have come from having other degrees, obviously, as well.
Some have PhDs.
And some have PhDs when they enter medicine, so there's a huge range of abilities and prior knowledge. So when they get to Year 3, they only really have some very basic foundational skills, most of them. And Year 3 is when they plan the research project alongside a supervisory team. They do a literature review, a proposal, they get their survey tools together or whatever they're going to use and get their ethics approved. And in Year 3, they have Friday afternoon timetable for research. And then in Year 4, they actually do the project. So these projects span over 2 calendar years. And they do the project in their group alongside the supervisory team. So this is when they're collecting the data, analysing the data, writing up a report and presentation. And again, they have Friday afternoon for research and a full-time 6-week block at some point during the year. So that's an overview of where the research projects fit. There is then a Year 5. Year 5 is the last year of the program, and then they have completed their ending. So at the moment, we are recruiting for groups to take students in 2027 and 2028. And each year we need about 50 groups. We tend to put around 4 students in a group if we can do that. In previous years we had up to 6 people in a group, and that was far too many. Unfortunately, there's also a lot of movement. So at the end of Year 3, some students won't progress to Year 4, and so they will be lost from a group halfway through, and then some return to Year 4 at another point and have to be reallocated to a group. So we also don't want the groups to get to 2 or 1. Unfortunately, it's never happened. I don't think we've ever got to 1 student. The groups are based on where the students are located in Year 4. So across the JMP, there are 6 clinical schools: Newcastle, Maitland, Gosford, Taree, Tamworth and Armidale. And as you would expect, Newcastle is the biggest site, and then the rural sites tend to be smaller. Up till now, each year there's been $500 of support for each group to pay for things. Often it's gift cards for participants in focus groups or surveys or studies. That's not guaranteed every year, but it has been approved every year up to now. And the students get access to 3 hours of statistical advice, which I'll explain a bit more about later. So we're looking for all types of research projects. Probably about 50% of the projects we get each year are systematic reviews or scoping reviews. So that's very much acceptable. A lot of the projects will be secondary data analyses. So if you've got a data set that you want something analysed from, this is a good opportunity for that. A lot of medical record audits and things like that get done. Some groups do collect and analyse new data from, say, a survey or questionnaire. Some do qualitative interviews, and occasionally someone will propose a lab analysis. But that's more rare, and Adam can talk to that experience. In terms of topics, anything health related can be proposed. So there are often a lot of quality assurance type projects in the hospital system that get proposed. Yeah, they can be biomedical, public health, advocacy, policy related. And we do encourage submissions of projects related to communities experiencing health inequities. So Adam can talk about Q3. So feel free to stay there for a moment, Adam, and it's up to you.
Q3, so yeah, we get Friday afternoons, and they're thrown into a group based on the clinical school they're going to be in year 4. So sometimes those 3 or 4 students could be spread out right across the footprint. More often than not, you've got at least 2 local. So most of it is done over Zoom meetings. And it's kind of like an honours year. They start off doing a literature review, progress that to a project proposal. They then swap with another group. So they get the project proposal to peer review, and they get some peer review back before they submit their final project proposal at the end of the year, well, in September or so. So in terms of workload, what we require of them actually isn't all that much. I mean, the literature review can be trimmed down and form the introduction to the project proposal. They get peer review from their supervisors and their peers to refine it. It's only 3,500, 4,000 word document, so it's not particularly onerous. The challenge is getting them into the field, learning techniques that they might need to know, and getting ethics through. So if your project doesn't have ethics already, you really need to get them onto that early, and we'll push and prod, but it really needs to be the supervisor who has that. And it's best in practice if they're joining in ethics that already exists, would be my tip for where things can go wrong. And then the other challenge that can pop up is group dynamics. They don't choose who they're grouped with, and that can work variously well. Some groups get along swimmingly, and some do not. And that's often where I get involved, is trying to sort out groups that are just not functional, and we try and iron those kinks out before year 4 when they're actually doing the research, which sort of works. We pick up a lot of the worst ones.
Yeah, so they do get access to various skills and so on online, but I think there's a variable uptake in how much they actually read.
But part of the challenge is just the diversity of projects. So
yes,
most of what they need to know, only their group will need to know. And so a lot of the resources are there. Their supervisors need to point them and guide them to what they need to know, particular for their project. Because if you're doing a systematic view, you don't need to know how to use a comparator. But if you're doing an ELISA, you don't even know how to do a systematic view. And that's,
yeah. Cool. And then in year 4, I'm the course coordinator. Usually most of the issues have been picked up, thanks to Adam. Occasionally there will be issues in year 4, but that's my role, is to help facilitate any problems, or solve any problems, whether it's between individuals within a group or with them and their supervisor, or issues the supervisor has with the students and so on. So as I mentioned, they get the Friday afternoon, but also a 6-week block. So as you can sort of see roughly from this calendar, they have 6 blocks throughout the year. So in year 4, like, they're doing pediatrics, O&G, medicine, and psychiatry, and then they also do a pathway, which could be like global health or Indigenous health, rural health, that kind of stuff. And they'll have a 6-week period to do their research in blocks 1 to 5. So their assessments at the beginning of the year, they have to submit a progress report, just something that basically shows they've checked in with the supervisors and they're actually thinking about the fact that they have to do this research, because all the other assignments are due in November. So a final research report, 5,000 words, it's basically like a paper, and a research presentation, 10 minutes plus 3 minutes of questions, so just like a conference. And that forms all of their marks, although these courses are ungraded passes, so they don't actually either pass or they don't. They also have to do a reflective journal of their reflections on being involved in research, a record of engagement, and their contribution and professionalism gets rated by their peers and their supervisors, both in Year 3 and in Year 4. And this is where we try to pick up on group members who aren't contributing, and hopefully all of those issues are flagged way earlier than this. When they do get flagged very late, then those who haven't been up to scratch have to do a supplementary task to pass the course. That's how it's been running.
One thing that would be worth mentioning is a problem we run into is supervisors are too nice. So if you have a student who's not doing the right thing, the earlier you say that, frankly, the better it is for the student as well. That's probably true across most research training opportunities. Flag problems early and loud, because often supervisors report to they're fine, and then you get to the last one, they're like, oh yeah, that student never can do anything for the last 2 years.
It's really hard to fail at the point when they haven't been given a chance to remediate. So that's one of the downsides of group projects, obviously. And yeah, so we hold presentation days at the end of the year. So if anyone's interested later on this year, the 17th of November, the presentations will be held here from the Maitland and Newcastle groups. You'd be most welcome to come along and check out what students achieve. So as Adam mentioned, there's ethics approval. The only additional sort of requirement here is that the university at which the students are enrolled, the approval needs to be registered with that university ethics if it's coming from a health ethics. And some groups will have students that are enrolled at either university, so then you've got 2 steps to do there. Their statistical analysis support, so they can have up to 3 hours with Erin or Josh, and this will be things like advice on how to conduct a basic analysis or sample size calculations, things like that, troubleshooting their data management and analysis. Sometimes they help them work through a statistical software and help interpret results, but what they don't, you can't just hand it over and ask them to analyse it. So yeah, we encourage the students to have met with the supervisor prior to their research block, discuss expectations, ask about training required, confirm on ethics, and check if there's any other data access approvals that might be needed, see if there's anything they need to order for the project, what it should be reading. And those are the things they generally should discuss with the supervisor, but a lot of the onus is on them to work as a team and help, allocate tasks between themselves. The students are very much, professionalism is very much drilled into the medical students, particularly in clinical settings, but in any setting. So professionalism encompasses the moral attributes, standards of behaviour and practice, and the clinical competence that the community and the profession expect of a developing doctor. So this is taken, or more and more being taken seriously by the JMP, and more being taken seriously in research, because I think the students have thought that research is a bit of a time off. But earlier this year, a prominent clinician researcher here at HMRI had a group in rotation 1. This year, he had 5 students in the group. He provided desks at HMRI, which is pretty amazing. He provided opportunities to have lunch and integrate with his research team, as well as clinical opportunities to attend various clinical meetings and so on. And only one of those 5 students took up those opportunities. The other 4, had about 50% attendance. And he was not happy. He was at a loss as to why these great opportunities weren't taken up by the students. So as a result, the 4 students had a one-on-one meeting with the supervisor, with me as the course coordinator, and with the professionalism lead of the JMP. And 2 students had one-on-ones, and then there was a bit of a break before the next 2. And essentially, in between that time, they pulled their weight and started working properly. So it was a very interesting example of, like Adam says, to come down quite hard. They were told they could fail based on lack of attendance for research, and that really gave them a bit of a shock. Unfortunately, because of the nature of different types of supervisors and topics and locations, there is a variable way that things are run. Some groups are literally working remotely with their supervisor, whereas others have set out expectations for attendance, and so they tend to think, oh, well, that group didn't have to come in, so I won't. But yeah, we very much try to cut back on that and insist that they attend meetings appropriately and so on. So the expectations for the students are that they'll regularly communicate, that they will participate in the research experience and they have that reflective diary minutes, respond to feedback, abide by requirements for ethical and safe conduct of research, and strive to deliver a high quality research product. And so while publication itself is not a requirement of the course, many supervisors do encourage publication, which I encourage them to do. And I'll talk more about that in a minute. So in terms of who can supervise, we do require 2 supervisors per group, one of whom should have relevant experience, maybe it's supervising honours students or above. You have to be a UON or UNE academic or conjoint, available fortnightly for the duration of the project to meet with the students, especially during the 6-week block. And there is some flexibility in timing of that block. You can say, like Joycey might say, I'm not available until September or whatever it is. I don't want my group to be in January to March or whatever. So you can say when you're most available for that. Providing feedback to the group, ensuring that the ethics and governance approvals are in place, and then, yeah, completing a checklist around the professionalism and participation for each student, and ensuring that if there is a publication that arises, that it appropriately acknowledges the contribution of the students and gives them an opportunity for authorship if that's appropriate. So Adam and I run monthly Zoom drop-in sessions on the first Friday of the month, so half an hour for students, half an hour for supervisors, so that's a chance, but obviously you guys can pop in and see us anytime. We've started a new initiative where we're trying to inspire the students as to how research can benefit their clinical career, and what benefits it can have for them. And so next Friday, Jeanette Lecter-Scott is going to kick off that seminar series. And so, I've been very honest about the the pitfalls of this, some of the limitations of supervising these groups. However, we will end on a positive note. There are some good successes that have been observed through this. So there's 31 known publications up to the cohorts from 2023-24. There is a bit of a lag, as you all will know, in publications. So the 2024-25 cohorts haven't published anything yet, but that's changing all the time. And this is just to show you there's been a range of publications come out of these projects. And Adam's going to talk about his experience.
Yes. So this is a group we had in the first cohort, which is wonderful because they were trying to do a lab-based project in the middle of COVID as well. The students aren't trained in laboratory anything, so you've got to be doing things with them that they can do. So they slotted into this paper as part of a bigger study. We had already collected urines from about 120 babies at the time, and they looked at urinary EPX. So they learned how to handle the samples in the lab and run the ELISAs. It was a bit messy because we had to kind of we weren't allowed to have as many people in the room as at that time, so we had to sequence it. But they were quite diligent and communicated well and were a good bunch once they got their head around that they have to do something in a lab, because they were all a bit nervous about that first. And it was just an ELISA, so it was a fairly entry-level technique. They were able to do it. 184 samples we managed to get them to run. And they contributed this table to the figure. Basically, we could see that the urinary EPX was associated with bronchiolitis. The main paper was looking at pheno. And in the subgroup that we had a successful pheno same infant as we had urinary samples collected, we could see there was this inverse correlation. So that was interesting to us because both are considered in different contexts as proxies for eosinophils in the lung. But we now think that it's a little bit different in babies because you collect them with a mask and the nose is the primary source. So it's changing what pheno could mean and how we should be interpreting that. So it was a valuable contribution to the paper, but it's a whole paper and that's their contribution, just the one together. This is another paper. So this was a systematic review. This is a group Vanessa and I became supervisors of in year 4. So they were stuck in Singapore again, COVID. Was that his group?
No, that was a different group.
It was a different group.
I can't remember where this group came from and why they landed with us. I think maybe the supervisor wasn't happy to continue or something.
Part of our role is that when there's a problem, we have to make sure it gets fixed, which
We get to
often is you take over the broken groups. Oh no, yeah, I remember this group now. Yeah, they had disagreements within the group and the supervisors didn't like it. So this is just an idea. So this is just in 1 year.
Yeah, so they had to do 2 years worth of, or, get their head around a new project in 1 year.
Yeah, so and it is a fairly specific topic. Not many people have thought about it in pregnancy. So they were able to get through almost 1,200 papers for the systematic review, which gives you an idea of the scope of what they were able to chain through. And they did actually some quite nice meta-analysis. So they were able to pull the data out and do all the analysis with coaching, and they did a few figures like that. So that was actually quite a reasonable systematic review. And I've had a couple of groups now deliver those quite well. So if you need a systematic review done, but not in too much of a hurry, it can be a good opportunity to get that. And they can do, the good thing about having a group is that they can cross-check each other. And again, with the lab-based and analysis-based work, I always get them to work in pairs and they both do it. And then I verify that they're the same. If they're different, then I look into which one's right, because it just gives, I wouldn't say they're intentionally going to muck things up, but they're just not experienced. And they haven't had a lot of teaching, so you need some sort of validation to have the confidence to take that data and publish it. And that is one of the advantages of the groups.
Where they got that training in laboratory? Is that as part of curriculum? Or
Oh, that was me.
are you training?
Yeah. So they don't arrive with any particular skills in it. The one thing I would say groups are good at is medical records. So if you've got a cohort and you need a bit of data that you've got to collect with your trial, a student group is excellent at going through and pulling all that out for you. That's probably the thing that they're skilled in that could be useful.
That's true. Yeah, so these are some of the papers that have come out of the groups that I've supervised. I think I've supervised 18 groups now and had 6 publications, another one under review at the moment, and then another 7 that I want to progress to publication. That sounds like a lot. And only 4 where I'm like, I'm never going to publish from that. So about 30%, I think Adam worked out about 30% of the groups end up with a publication within 5 years. And that's about my personal success rate as well, although I hope to get that to 60% by eventually.
Some of those never published ones, though, are ideas that you've had and data that you've got, and the group can look at it, get what they need out of it. But if it's a null result, it's
So we had a
really
group
publishable.
last year that we had to rescue, and I said, it was halfway through year 4. They had a supervisor who thought they could do an RCT, and then despite multiple attempts at getting him to come down from there and give them something more reasonable, they didn't get ethics. And in the end, we pulled the plug and said, sorry, you cannot supervise this group anymore. They need something right now. And so I had some hormone data from 2006 or 2005, data that had been sitting on my desk for 20 years. And I had a quick look at it, never really had a proper look at it. So we got them to analyse this hormone data in pregnant women with asthma, and there was really no relationship between estradiol, progesterone, and ACQ and exacerbations. So, they got a report. I worked out just to leave it sitting on the shelf for, and not worry about moving on with it. So, yeah, sometimes that can be useful too, just to know, oh yeah, we did look at that data and there wasn't anything in it. So these are some examples. So this was a systematic review where I brought in Tez, who was interested in PM 2.5 and air pollution, and Olivia, who was interested in ADHD and autism. We ended up, there was no data on autism in this. We had a bigger review that ended up shortened into just looking at particulate matter and nitrogen oxides and ADHD. But we were able to show an association between those two in this systematic review. This example here was from the very first cohort. So Josh Davis is an infectious diseases physician, and so as soon as COVID hit, he was unable to continue supervising his group. And so I stepped in, and even though I knew nothing about the topic, I was able to teach them how to do a review and a meta-analysis, and that ended up getting published. It was very pleasing. This one was also from the very first group, very first cohort, where we students actually did conduct some qualitative interviews. I think they probably did about 7 or 8 interviews. And we ended up combining those interviews with another set of interviews that Karen had previously done as part of her PhD, but had never published on. And so that ended up being a paper that Karen finished off. But they were quite good at those interviews. That was actually a really good student group. They were all, a lot of them were mature age, and they had good skills. I guess if you are going to do something like that, you've obviously got to be careful that they get proper training and how to talk to participants and all of that sort of stuff. However, you think being future doctors, hopefully that's a skill that they are keen to learn if they don't already have it. This one was a big population-based data set from e-maternity, so they did need a lot of statistical help with this one. And we ended up having Natasha Weaver, who was helping the students at the time. She put in some extra work with them in exchange for authorship. But yes, they handled that very well. They learned a lot about data management and statistics. And then the final one I've got here is an updated systematic review. So this is one approach I now have. So I've got some key systematic reviews in my field. Some of them are getting a bit old now. So my process now is to update various aspects of these reviews using student groups. So this group updated our neonatal outcomes. Last year I had one group do hypertensive disorders, one group do gestational diabetes, and this year I've got a group doing congenital malformations. So that's one of my approaches with this now, is to use the groups to do those updates of reviews. The pizza's here, so please feel free to get up and grab a piece. The next few slides are just to show the sorts of positive outcomes we've had. So one group published a blog post about palliative care and life-limiting conditions. We've had 2 groups win the medical dean's 3-minute talk competition. So it's a bit like their 3-minute thesis, only for medical students. And they won last year and the year before. Both of these groups were from Tamworth. And they both did, I'm trying to remember what type of projects they were, but
qualitative.
One of them at least with a qualitative study, yeah. So they do have potential, and with good supervision, I think there's some amazing things that have come out of these groups. And then Melody is a bit of a poster child, so she's the one on the right hand side of that photo. So she went with Craig and Tegan to Puerto Rico early this year for the Society of Reproductive Investigation Conference. She got 2 oral presentations and a poster out of her group's MD research project. So Craig tends to push his students pretty hard and he's never satisfied with just one paper. He's like, let's have 3 papers. But Elodie has gone on to do a PhD with Craig. She's currently doing that, and these are some of the things she had to say about what she enjoyed about the going to Puerto Rico. And we're finished by Adam will talk about the JFP Rise Academy.
So one of the reasons you might consider, and this is a low chance, but Elodie is an example of what can happen, is we've finally got it set up so the students are able to take time out of their medical degree after year 3 or year 4 and do a PhD and then jump back in for the final clinical training and get back on the pathway for that clinical training. So they can take 1 year out and do an MPhil, or they can take the 3 years out and do a PhD with you. The good thing about the research projects is you've got a chance to get to know them. I have had one student who wanted to do a PhD with me at the end of a project, and the project was a really good screening tool, so we didn't go ahead with that. And Craig's had a few over the years, but it's now a lot smoother. So either university, you can just take that time out and they're not going to interfere with their degree, which previously was a bit of an issue. And that's replaced the honours program that we used to have. So if you've got good students, and some are really excellent, it's an opportunity to test the water a bit like an honours year before committing to that from both sides.
Yeah, so I had one that I recently offered a PhD to, and unfortunately she decided in the end not to do it. She's in her early 30s and has decided to just finish medicine first, which is a very fair decision for financial reasons. But she clearly showed herself to be an excellent student right from year 3. They did their research block at the beginning of the year and have helped our team with a whole lot of data entry that wasn't part of their project. And I said to her one day, "You seem really interested in research. Have you ever thought of doing a PhD?" And she was like, "Yeah, I have, but I'm not sure what's involved." And she said, "I really love the research. I want to, I'd love to do more time on research if I could." And so she has continued contributing to our TTAP data entry all year, even though she doesn't have to. That's on speed. She's just been interested to be involved. And yeah, so unfortunately that didn't turn into a PhD student quite, but it was very close. and she may well, decide in the future or whatever, and she wants to remain sort of involved in the group in volunteer ways. So that's been really promising as well. Yeah, you can certainly pick the standout students.
Yeah.
Yeah. And I think that is basically it for our presentation. So happy to take questions, of course.
I have a question.
Yes.
So if we have an idea, then we send this idea via email.
Yes. So after this, what I'll do is I'll email the invitation or the group of people that are invited to the lunch with a template to fill out with who you are, what your idea is, and there's a few other questions about availability.
Yeah, and then do the groups get to choose what they are doing?
No, unfortunately they don't. There's a very
We're at the
complicated
bottom of the pecking order.
timetabling system that means that that's not possible.
They're just allocated to something, even if they don't, they're not interested, they have to do it.
Yes, that's correct. Yeah.
Okay.
It's one of the limitations. Yeah. Although, we do get students who turn around who come in and say, "I don't care about research, I just want to be a doctor. What does it matter?"
Yeah.
And by the end of it, they, in their reflection, they'll say, "Oh, I was really skeptical about research, but I really enjoyed it. And now I'm thinking about doing it as part of my career or whatever." So there's definitely an opportunity to change people's minds a bit. And sometimes that happens with topics as well. They might come in thinking, "Oh gosh, breastfeeding." Yeah. And by the end, some of them like, "Oh, it was actually really interesting." So yeah.
I was going to ask, do you get feedback from their perspective? I really love the systematic review, or do you get people that mostly love learning lab techniques or looking at secondary data analysis? I don't know.
Because they don't get to.
Yeah, so
Yeah.
yeah, I
They
guess
can't
it's hard.
Yeah, it is, the whole comparison with their peers is hard.
Yeah.
One thing is I'd say most of them have kind of science way of looking at things, so if they get into a quality project, we do get a lot of positive feedback from, quality research is actually meaningful,
Yeah.
so that it's a consistent
Mm.
trend, but a lot of, some people like, some people don't like particular
Yeah,
field and style. I think they all like the lab work, but it's very hard to do lab projects. You've got to have a lot of things in place.
Mm.
So there's not too many have done that.
And they need to come here also for that work.
that's right, yes, you would have to have an on-site.
So it is structured in such a way that they are able, that they're assigned to where they'll physically be in year 4, so they can come on site. So I've happened to other groups do lung function at hospital, and so it can be done.
Yeah, but for other premises.
Yeah, so we try to,
Those students will be associated projects.
we try to have local projects for local students, but it does, so for example, in Armidale, where I think we did 6 groups, sometimes we only get 3 Armidale specific projects. So the other 3 groups might be allocated to me on a systematic review, for example. So then they have to work remotely with someone. Yeah. But as much as possible, yeah, we try to get the TARI students to the TARI project. So on, yeah. No.
So the students in each group, like each student will get different grading.
Sorry, each student.
In a group, will get the different grading. It's not the same,
No, so they do everything as a group, so only one assignment is submitted,
Yeah.
only one presentation, they all stand up and they have to talk. The requirement is they have to say something during the presentation. And yes, so they only get 1 grade, but it's an ungraded pass.
Yeah, so the JMP doesn't give grades,
Okay.
so doesn't matter.
Doesn't matter.
Yeah. As long as they're meeting this.
But in authorship, you may think about who is coming.
Yes.
Yeah, so you probably noticed, at least in my examples, I don't think I've ever had a student go as the first author.
Yes, I'm not.
So far, I haven't had anyone who's been that enthusiastic to continue, to drive the publication. Because often, they get towards the end of year 4 and we realise, this is great, this is going to make a good paper, but they don't necessarily have the time or the inclination to then put in extra work over the summer, and then while they're doing year 5, which I'm sure is busy as well. So they mostly end up as middle authors, but certainly there are some groups that have published where a student has taken the initiative to be the first author. So, if they want to, they can.
Particularly some of the students who already had a PhD of
Yeah,
papers as well.
yeah. And so it has given opportunity for some of my postdocs, like Annalise and Soraya, have ended up as authors or first authors, because then they've taken on student work and driven it to publication. So sort of half done or mostly done, and then they make sure they get a first author out of it. Yeah. Good. Yeah. Anyone online have questions? It's still just Mike.
What and Amber now?
Okay. Any questions, Mike?
No questions, but when would they be due? When would the proposed?
Oh, yes, great question. Preferably by the end of July, but we don't make decisions until probably September, October, and then you'll be notified in early December as to whether you've got a group. We won't be able to tell you who's in your group until early next year because of, whether students continue and fail or whatever, yeah.
Yeah.
So, end of July, I'll send those details around with the documents this afternoon.
And are you guys recruiting supervisors yearly? Every year
Every year we need another 50 projects, and then there's an increase in the number of students coming up, so we need 55 projects.
Do you ever have trouble getting that number of projects?
Pretty much every year.
And then,
Particularly across the rural sites.
Yeah.
But yes.
and then what do you do? Like what happens?
And Adam and I come up with things.
Yes.
Or we jump in.
Yeah.
Yeah.
We're both.
My approach now is going to be to hold off, and then if there's a need, I'll put something. Because I had 1 year where I had 5 groups. That was not sustainable. Yeah. Alright, thank you.
Bye, everyone.
Bye, bye.